May we have Bram van Hove to discuss sensor-controlled patient compliance with postoperative splinting. Thank you.
Thank you. Okay, so thanks for having me. I'll be discussing this quite simple study actually, but practical in daily use. So what we did was a sensor-controlled study to check if the patients were actually wearing the splints as we prescribed them after Dupuytren surgery. I don't have a conflict of interest. So it's still common practice to prescribe splints, to give our patients splints after surgery. Sonia discussed this already quite elaborately. The evidence on this is, as discussed, not very clear. Some studies show benefit, some don't. Our hypothesis was that maybe this is because we're not really measuring correctly, or we don't really know if the patients are actually wearing the splints as we prescribe them. Usually it's done by questionnaires, but again, everybody can lie. So what we did was a prospective study, observational. All our patients post-op, we gave them a Voller hand-based extension splint in which we incorporated a temperature sensor. We counted as 1 day if the patient would wear the brace for 4 hours continuously. The data was stored in the sensor and could only be read out with a sensor, with an NFC reader and a special software, so it was quite safe. Of course, we had to inform the patients that they were in a study. So they did know that there was a sensor, but they didn't know that we were using it to follow their compliance. Because there is actual studies that show that if patients know that we're watching them, they will be more compliant. This was done with scoliosis splints. So it's just like little kids, if they know you're watching, they will modify their behavior. So we couldn't tell them. And that was actually the most difficult part of the study. I said it was a simple study, but it was really not. The most difficult part was getting the ethical commission on board, because we were criminals, liars, we were lying to our patients. But finally, through some, we managed to find the authorized deception protocol, to which he agreed finally. So it's a small study, I have to admit, 25 patients. The inclusion criteria was surgical treatment for contracture, 1 or more fingers, no needle, no collagenase, no skin grafts, no revision surgery. They all had their brace and their sensor applied 3 to 5 days after the first post-op visit, of course with the standard post-op wound care and physiotherapy. They were instructed at every visit, wear this brace every night for the next 3 months. And every time they came back, we told them, please wear your brace, as you usually do. We saw them at 3 to 5 days, 2 weeks, 6 weeks, and at 3 months. And then at the 3 months, we did a readout of the data, and we asked them to fill out a questionnaire. These are how the data came out of the sensors. So this is of a mediocre patient. About 48% of the time he wore his brace 3 hours a day, so not great. And this was a lady who kept a perfectly logbook describing every night, so she was the most compliant that we could have, 8 hours a day, 97%. The demographics, so 63 years old, 8-to-1 male-female sex ratio. Actually, one of the results that we saw was that on average, if you look at all the patients, they would wear their brace 5.4 hours a day. This was modified a bit. If the brace was painful, they would wear it less often. If they thought the brace was useful, they would wear it more often. If we look at the days that they wore their brace, so we prescribed them 3 months, so about 90 days. And we measured about 60 days that they wore their brace. So on average, 70% of the prescribed time they were wearing their brace. But as you can see, there's a big difference. Some people never even bothered to put it on, but 70% is the average that you get. So on the patient feedback, most patients thought their brace was quite comfortable and they saw it as a useful tool. And why wouldn't they wear their braces? Well, mostly if it was painful or, oh, I forgot about it, my wife couldn't sleep because of it, or I didn't think it was necessary. So again, a simple study, a simple conclusion. What we tell the patients to do, about 30% of the time they will not do it. On average, they will wear their brace 5.4 hours. If it's comfortable and they think it's useful, they will wear it more often. So that's maybe an easy thing to convince them to wear them more often. Previous studies don't show clear benefit, but we don't really know if the patients were actually wearing their brace. So maybe it's useful to do a larger study with sensors in every brace to see if we can find out a difference between the wearing time or not. I thank you for your attention. This is my talk.
Question over here?
Did you do any comparison between what the patient told you whether they were braces and what they actually did?
We did actually have a questionnaire and they had to fill in a logbook. They were quite honest, yeah, to be honest. So we can trust our patients. I think in other studies with questionnaires, you also end up with a 75% rate of people saying that they wear their braces. So they are actually honest, yeah.
Wouldn't a conclusion be that we should just tell the people that there are sensors
Yeah,
in the brace?
definitely. Very easy way. Very easy way to improve the compliance is that we are watching you, and they will be more compliant indeed.
Wouldn't you think that wearing the brace in the night would be better than during the day? And have you made the difference? Because usually we just relax very much in the night. We are tending to bend our joints like that.
Yep.
And wearing it during the night would be a better training than during the day.
Definitely. Maybe I didn't specify, but it was nighttime splinting that we did. So they wore them at night. During the day, they were actively moving. Yeah. Okay.
I'm just wondering, I think also with sensors, there's potentially a use for understanding what an appropriate dose of splinting is, because for many of these things, we sort of guesstimate nighttime because you figure you'll get about 8 hours,
Yeah.
but we don't know that that's sort of an effective dose of splinting, do we? So it might be, have you thought about that in the future, that you might use the sensor to sort of look at effectiveness of splinting and then determine what is an effective dose of time?
You can definitely try to quantify more the usefulness of the brace by measuring how long it's been worn, and then comparing that with the clinical outcome. But you need a bigger study than this one to get significant numbers. Yeah.
Great. Anything else? Going.
Thank you.